Hello, child welfare professionals. In our previous video, we provided a broad overview of the EPSDT benefit that's included in Children's Health First Colorado coverage. This video provides details to help you fulfill your responsibility of delivering healthcare services to children under your care. It focuses on understanding the technical aspects of using EPSDT. Let's make sure every child gets the comprehensive care they deserve. As a reminder, EPSDT stands for Early and Periodic Screening, Diagnostic, and Treatment. It's a crucial Health First Colorado benefit designed to ensure children below the age of 21 receive proactive and preventive healthcare services. EPSDT focuses on preventive services and screenings. These include routine health screenings, assessments, and testing for vision, hearing, and developmental milestones, as well as vaccinations, and more, as well as diagnostic and treatment services. These include diagnostic tests, specialized therapies, chronic health condition management, specialized medical equipment and supplies, and other testing, screenings, or assessments. Basically, if it's healthcare the child needs, EPSDT will cover it even if it's not typically covered by Medicaid. Before we explain the process for accessing EPSDT benefits, let's get familiar with some of the important terms. Understanding them makes navigating the process a lot easier. Because EPSDT covers such a broad range of health services, sometimes these services are provided within the Medicaid network, what we call a managed care entity. And sometimes these services must be provided outside of it, what we call fee-for-service providers. The managed care entities for mental health and all care coordination are RAIs. The RAIs' responsibilities include ensuring Health First Colorado members, including children, have access to primary care and behavioral health services and coordinating members' care. You will have to work closely with the child or youth's RAI throughout the process of accessing necessary health services for the child. Now let's get into the process of accessing care with EPSDT. This is a general overview, and some things might work slightly different in your region. First things first, you need to ensure the child is eligible. If the child has an entitlement span in Trails, the statewide automated child welfare information system, or an open medical span in the Colorado Benefits Management System, they are eligible to use the EPSDT benefit. Children with more acute medical needs can also apply for Health First Colorado coverage, even if they have private insurance. More information about eligibility can be found at hcpf.colorado.gov. Now that the child is eligible, it's time to get them the care they need. Here, it's helpful to think about your own experience with healthcare. Sometimes, your healthcare provider can provide services immediately without needing to get approval from your insurance provider. Other times, your healthcare provider needs to get approval, or what we call pre-authorization, from the insurance provider before delivering care. They may also be asked by the insurer to provide documentation that proves the service is medically necessary for the child's health before approving the care. It works similarly with Kids Health First Colorado coverage, with one major difference. Unlike private insurance, where a denied claim typically concludes the process, for children with Health First Colorado coverage, EPSDT could step in or may be able to cover care that would have been otherwise denied by a private insurance company. Amazing, right? But you have to work collaboratively with the child or youth's RAI to access these healthcare services. As the temporary guardian of the child, you are likely to have children come under your care who have urgent and critical health needs. In these cases, it's critical to reach out to the RAI for help on how and where to access care. If pre-authorization is not required for the requested health services, and those services are available through the RAI's managed care network, the RAI will provide coordination to ensure quick and effective delivery of the care. If pre-authorization is required for the requested health services, the healthcare provider may have to prove a medical necessity by providing documentation to one of Health First Colorado's utilization management companies, or UMs, before the care is authorized. This process may take several days, but it will be done. The will notify the parent or guardian of the decision. Providers can also check in the system for the status of the request. Now, denials will happen. Typical reasons for denials include a lack of documentation that demonstrates the medical necessity, or it's an experimental or unproven treatment. Experimental or unproven treatments are not covered by EPSDT. However, a denial due to the lack of documentation is easily corrected by providing additional documentation to substantiate a medical necessity. If a request is denied, a provider can resubmit the request with additional information. Remember, RAYs are responsible for case management even when the child is in the Department of Human Services custody. If you need help accessing care for the child, reach out and coordinate with the child or youth's RAY. They're there to assist you. Now let's talk about early and periodic screening services provided by EPSDT. EPSDT covers mandatory early periodic screening health services that must be provided to kids with Health First Colorado coverage in your care. Routine preventative services like physical exams, vision screenings, hearing tests, dental screenings, immunizations, developmental assessments, and more are covered by EPSDT as often as needed if medically necessary. All you have to do is schedule a visit with the Health First Colorado provider. No pre-approval is required to access these free services. So what did we learn? If a child in your care needs health services to prevent or treat a health condition, ask the child's RAY for it. Even if you don't think it's covered or it's not covered in the RAY's network, it's likely a fee-for-service provider or EPSDT will take care of it. Get to know the child or your youth's RAY. They're your partner and resource in making sure that kids under your care have access to early and periodic screenings and diagnostic and treatment services. When you know the RAY and the process for working with them, everything flows easier and kids get care quicker. With this knowledge, now you can get kids under your care the health care they need using Health First Colorado's EPSDT benefit. We have more resources for child welfare workers at hcpf.colorado.gov or contact the RAY with additional questions.